Governor Gretchen Whitmer says a nationwide ban on flavored e-cigarettes is exactly what needs to happen. President Trump yesterday revealed his plan to do just that 1 week after Governor Whitmer made Michigan the first state to ban such flavors. Both sides of the aisle are concerned about these devices and flavors being marketed to kids and young adults. This morning, Governor Gretchen Whitmer told the Today Show that what she's doing to crack down on that.
We know from how e-cigarettes, these flavored e-cigarettes are sold, they're sold right next to the candy. We're taking down billboards that we're going to ensure that they're not going to be able to target and market to our children.
Right now, the FDA is developing guidelines to remove thousands of flavors. Those will likely be released in the coming weeks. It's one of the most common chronic health conditions in the U.S., and hearing loss tends to leave those suffering from it feeling isolated. Now, a new study suggests hearing aids can do more than just help a person's ears. Mandy Gaither explains.
Almost twice as many people report hearing loss as they do diabetes or cancer, but a new study shows only 11% of women and 13% of men use hearing aids. If you've rejected using one in the past, you may want to reconsider. A study published in the Journal of the American Geriatric Society examined nearly 115,000 people aged 66 and over with hearing loss. It determined those using hearing aids had about an 18% lower risk of getting an Alzheimer's or dementia diagnosis within 3 years of a hearing loss diagnosis. In that same time period, the risk of being diagnosed with depression or anxiety was about 11% lower for hearing aid users, while the chance for being hurt after a fall was about 13% lower for those using a hearing aid. Researchers say although there are clear links between the use of hearing aids and lowered risk of mental decline, more studies are needed to examine cause and effect. For today's Health Minute, I'm Mandy Gaither.